In parts 1 and 2 of this 4-part podcast on psychic retreats in music psychotherapy, we have looked at some possible causal factors in why a patient might seek refuge and retreat from meaningful contact with a music psychotherapist. I identified the unmanageable feeling states of shame and its projective component disgust, excessive envy and envious attacks on internal and external objects, as well as unmanageable greed and the fear associated with never being able to introject enough to achieve an internal goodness that an ego can own in service of a growing identity. We also looked at the difficult concept of the combined object, where normal splitting of experience into good and bad and its inevitable projection into external objects is interrupted by an archaic Oedipal struggle, where a containing presence, the mother, malfunctions and she herself is narcissistically involved with herself. A mother, for example, preoccupied with her own depression, creates an archaic Oedipal triangle that excludes and threatens the growing ego. And unlike later ambivalence, causes confusion. All of this I consider observable phenomena within a music psychotherapy session where there is no prescribed or defined task other than the onus on the patient to reflect on a musical enactment. Within this conceptual frame, music itself can be seen as a retreat that can stymie progress and divert energy away from insight. In this podcast, we'll look at Klein's 2 psychic positions in more detail, the paranoid, schizoid, and depressive positions, and how they relate to John Steiner's retreat, and also give some examples of how this sounds and feels musically. We can think about Klein's paranoid schizoid position in terms of fragments of experience coalescing in the infant's evolving consciousness as raw sensation, both good and bad, is introjected by the infant's mind, whose fragile ego attempts to control his annihilatory anxiety through a magical domination of these part objects, especially the breast. John Steiner then relates this to adult regression in analysis in terms of states of persecution and idealization that tend to alternate, and if one is present, the other is usually not far away, having been split off and projected. He says that together with the split in the object, the ego is similarly split, and a bad self is kept as separate as possible from a good self. Steiner then describes how the depressive position represents an important developmental advance in which whole objects begin to be recognized and ambivalent impulses become directed towards the primary object. Increased capacity to integrate experiences lead to a shift in primary concern from the survival of the self to a concern for the object upon which the individual depends. This results in feelings of loss and guilt which enable the sequences of experiences we know as mourning to take place. Continuous fluctuation between these two positions takes place over months if we're thinking developmentally, or in the transference moment by moment in an analytic session. Like the paranoid, schizoid and depressive positions, Steiner continues, the psychic retreat can be thought of as a grouping of anxieties, defenses and object relations but its structure is marked by the rigidity conferred through the pathological organizations of the personality. This pathological organization is formed when persecutory anxiety becomes excessive. This may leave the individual feeling that his very survival is threatened. Such a threat may paradoxically lead to further defensive fragmentation, which involves minute splitting and violent projection of the fragments. I described earlier the concept of the combined object, and I hope we can begin to see how something of this nature may be at the root of the torturous, unbearable internal state the patient might be in, and how this demands further splitting to manage it. Now, this may well be at the root of Steiner's idea of the narcissistic pathological organization that rules the psychic retreat. To explain, splits in the object and ego manage the endless perverse disturbance of a combined object and its ensuing confusional state by decimating it. And projecting out the individual pieces onto external agencies in the world like the CIA, the government, God, etc. And then re-internalizing these as a gang or mafia that police consciousness with a rigidity that can give some relief to a tortured soul, but only at the price of allegiance to the gang's code. Now, because reality is understood by the patient to be the confusional state, a retreat takes place into a narcissistic, syncretic or self-referential state where negative symptoms abound and the patient is ruled by this gang's code. Those with experience of general psychiatry, Steiner goes on to say, will recognize a striking example of this in the case of some patients who are admitted to hospital in a pre-psychotic state. It is possible to observe patients in a delusional mood in which extreme anxiety is accompanied by depersonalization and feelings of ill-defined dread, who may actually appear relieved as the diffused dread gives way to fixed delusions. Some patients, in fact, visibly calm down and cheer up as the anxiety and persecution become restricted to the area of the delusional system under the control of a psychotic organization. As a music psychotherapist, I'm interested in early infantile states because they are fundamental to our sense of self at a pre-verbal level and therefore musical, but also because they can be expressed through affect. As I described in the second podcast, if we're open to the patient's affect state, we will be affected by these powerful feelings from the moment the patient greets us, through their posture, their gesture, their eye contact, their physical intensity or presence. All of this will affect us as therapists, and a mood will be discernible if we are quiet enough to witness and experience it. Then playing together simply becomes an extension of this expression, which we can further explore together and interact with. It is for this reason that I try to wait for the patient to be proactive in their communication. My failure to manage this stance can also be seen as valuable information, albeit a counter-transference enactment in the moment. But if the level of anxiety remains too great for patient or therapist, then a psychic retreat may well ensue. Having worked directly with psychosis for 15 years, I recognize that a terrible dichotomy exists for the patient, in which unmanageable desire to be known by another is kept in check by fear of shame. I have seen in many patients now how the shame that might be experienced by the patient's sense of intrinsic failure is immediately disavowed and projected as disgust at a ridiculous and inadequate world that misunderstands their genius, for example. Any attempt I might make to prove my worth by interacting at a high level musically, for example, might well be met with envious attacks, like a demand that I should just be quiet and listen, and of course praise their expression. In this way, the therapist becomes an echo to the patient's Narcissus, just as in the Greek myth, Echo could only court Narcissus through the use of his own words, as Narcissus couldn't bear any sense of difference. Other signs of musical retreat include the presentation of unpredictable or complex musical structure brought by the patient that induce an unrealistic inadequacy in the countertransference of the therapist. The music itself can also be attacked. Perhaps it's deadened of its emotional quality. The music may go on and on and on, week by week, without developing or deepening in its emotional landscape. Other attacks on the musical form include those that distort its emotional meaning, or that distort its rationality, or continuity or tonality. In the fourth and final part of this series on psychic retreat in music psychotherapy, we'll look at some more real-world examples, but also most importantly begin to think about how to help a patient move from that retreat position to the depressive position and the role of mourning in that transition.